Good afternoon. How are you both doing?
Good.
Good. Thank you. Okay. So my name is Pradika. I'll be your trainer for today. So I'm just going to give you a teaching session today, and we'll just introduce ourselves. And it's going to be a half an hour of session, and we'll go through the content and things. All right. So the main topic today is going to be debriefing style communication. So I went through your assessment and I found out that both of you have worked as an educator and you have a need in the area of increasing your oral communication skill and your writing the report skill following a debriefing incident. So we'll go through that pattern now. And so that's what is going to be the main intention of this training. And so I work as a trainer, and my full name is Pradeepa Sarvaraj, and I work as a clinical nurse educator as well. Alright, so as I said, again the purpose of the training is going to learn debriefing oral skills and to learn retrospective debriefing report writing. Okay, so now moving on, this is going to be a content, so we'll have a small introduction between ourselves so that we can all feel comfortable together as a team and take this training forward. We might have to see each other for a couple of more sessions in future, so we have to feel comfortable about the entire group. So if you have any questions, you can ask me as well. Alright? So we go through some housekeeping rules. Icebreaker is there, and we'll go through what debriefing is, the debriefing frameworks, and what questions to ask to these the candidates, and how to write a retrospective report. And so there will be a practice activity in between where I will be providing you guidance, and at the end there will be an assessment if you are ready, where you both of you can interchange and you can assess each other on both your oral and writing communication skills. And then there would be a conclusion and then a feedback session as well. Okay. So any questions until here? No. Lovely.
Can we put the
blinds down?
Yeah, sure. Please.
Yeah, sure.
That will be too bright. Too bright, and it's a bit stare.
Yes, of course. No, it's gone down.
Is
that one is okay?
Yeah.
Yeah. All good. I'll just check whether
Check.
it's yeah. Oh. Yeah. Good.
Because it's glaring.
Glaring, yes.
Thank you.
No worries. So what we're gonna keep an eye on the time as well. So few housekeeping. So the main thing is I would like you to introduce yourself to me, please. I'm so sorry I have to go through a few things before that. Yeah.
So my name is Richa.
Yes.
I work as attached CNS in the hospital.
Lovely. Welcome, Richa.
Thank you.
I'm Ellen. I work in the nursing education department, and I'm CNE as well.
Lovely. I went through your assessment report, so I know a little bit about you, but we'll know more about each other soon. Okay? So do you both know each other?
Yeah.
Yes.
A little bit, because you work in the same place, huh? Now you will know more about each other soon. Okay. Few housekeeping rules. So the fire exits are, in case of any evacuation, you just have to walk out, and wherever you see the green man running on your right side is your nearest fire exit, and same as on the left side. Next, your toilets are just opposite to the room, okay? And your tea room, oops, sorry. So your tea room is just opposite, next to the room as well. There's a staff tea room there. And if you want to have a break, please let me know. Feel free to have a break in between, and then you can come back if it's too much for you, because it's about debriefing session. All right. And mobile phones, you can put it in silent. And if you have to attend any phone call, you can actually go outside and attend the phone call. Just let me know. Is there any work health and safety issues that I need to know about?
Just that I'm pregnant.
Oh, yes, all right. If you need anything, yes, yeah, let me know. No hard work here. If it's emotionally draining though, this session, please let me know. We can break the session. We can take a break. We can do it another day as well. Okay, please let me know if it's interfering.
Sure.
Right. Ellen, do you have any occupational health and safety issues that I need to know about, or is everything all right?
It's okay. There's nothing. No.
Yeah, is the room comfortable? A little bit hot.
A little bit
yeah.
hot, but it's okay.
Yeah.
Maybe we need water later on.
Yes, sure. Yeah, no
later.
problem. We'll get from the TV.
Yes.
Okay, thank you.
That's not the way to drink, sister. And then we just Thank you.
Okay. So icebreaker, we're just going over. Have you gone through everything? Let's have a look. I think so. All housekeeping rules, yes. Icebreaker, we're just gonna have a small activity between you both so that both of you know a little bit about each other. How about Richa? Can you tell 2 truths and 1 lie about yourself to Ellen, please?
So does she have to figure out which
Which
one
one
is
is a lie? Okay,
the
which is
lie?
a truth and which is a lie? Yeah.
I came to Australia 20 years ago. I've had eye surgery before, and I have a son.
So which one is the lie you think?
Because I knew her when I came there, and also she had eye surgery. But this is her first pregnancy.
So there you go, you're busted, sister. Okay, that's a lie. Ellen, how about you tell 2 truths and 1 lie about yourself, and Richa will find out which one is the lie.
Okay. I came to Australia in 1987. Okay. And I started at Lidcombe Hospital as a trainee, yes. And I got 4 girls in the
Oh
family.
my God, that's gonna be hard, sister. How are you going to find out the lie? You know? Can you guess?
I know. No, we've talked about kids because we were talking about the pregnancy.
Yeah.
So I know she's got 3 boys.
So that's your lie. Okay. All right. So are you feeling comfortable now? Shall we move on to the session? So basically, it's just going to be the PowerPoint presentation. I'll ask few open questions to you. It's going to be very simple instructions. Any clarification needed, you can ask me, you can stop me at any time. I've given worksheets, template, handles for you to follow as well. So I can put it up here as well, and you can follow there in your hand. So there will be a bit of role play and scenario in this workshop, and it will be a comfortable one. If there is any issues, please let me know. So you would be working as buddies together. So the main thing today is about bereavement debriefing. Say for instance, in a hospital setup, bereavement debriefing is an intervention to support healthcare professionals in managing the grief after the death of the patient. It doesn't need to be just a death, it could be even a big cardiac arrest situation where you have done so much to retrieve the life of the patient, and then you would be emotionally stressed out and you would like to debrief after the situation so that it de-stresses you and you can improve on your performance next time for the benefit of the patient. Any questions on here? Good. So, with your oral communication skills, when you are debriefing a person, there's a lot of emotion and terms involved in it, and that's what I found out from your assessment that you have given, that it's too emotional. They are using a lot of emotional terms. It's really draining for us as well. How do we concentrate, listen, and what kind of questions do we need to ask so that we don't break them down completely? So I've gone through some of the debriefing frameworks that's been published in journals, and I've pulled out few debriefing frameworks and put it together to bring out your format there, which you can use to ask questions. So first would be an introductory phase. So the introduction over here would be the same as here. So you welcome your candidate. hello, how are you? My name is this, and I'm your debriefer, and can you tell about yourself? And you would review the purpose of the debriefing session. So what is happening inside the room will remain inside the room. It's all confidentiality. There's a lot of emotions involved in it. So at any stage, if you feel like you want to take a break, you can take a break. Have a box of tissues there, some water to drink as well, so that you can help them manage the stress. And so you can invite the participant and give names and answer the questions as well. And then you can ask questions like, how were you involved in the care for this patient and family? That's a very important introductory question, which is actually given in your introduction part there. Then moving on, is the speed okay? Is that all right? Next would be your factual inflow. So your introduction includes a little bit of exploration as well. How were you involved in the care of the patient? Next would be your factual information. Can you review the time of the death or time of that circumstance that happened or the cardiac arrest that happened? That's more factual, that's a realistic thing that has actually happened. It can be approximated time because some of the candidates, they won't be able to remember everything. Next is a case review. Case review is more about the situation where you can ask questions like, what was it like taking care of this patient? This would actually make them reflect back and bring up few emotions like, oh, it was a pleasant experience. No, the patient was a bit demanding, but still all right because I wanted to do the best for the patient. These are some of the examples of responses that we would hear. And what was the most distressing aspect of the case? So the most distressing aspect of the case is, if I was in that situation, I would say, for example, things like, oh my God, when I started my shift, the patient was walking beautifully, self-caring, and was talking with me a few minutes ago. And after 10 minutes, I can see this patient completely unresponsive. I was completely scared, horrified. So the scared, horrified are emotions. Those are important terms that needs to be noted down within codes so that it can be written in your reports. Next would be, what was the most satisfying aspect of the case? That can be examples like, the patient could have died, but at the same time, you would have helped the patient, the candidate would have helped the patient to go through that phase of death in a very peaceful manner. At least she did not die with pain. I am so happy that I have provided enough pain relief for her so that she passed away comfortably. Or I am so happy that I gave the maximum I can do. I gave the cardiac compressions for the patient and the patient got transferred to ICU. So I am so happy to learn that the patient is still alive and I've done my best to save the life of a patient. So these kind of emotions can come out.
So this is for grief responses?
This is for case review.
Still for case review.
Yeah, case review. Grief responses, this is just like your grieving. Okay, when someone dies, we grieve at different stages. This is very similar to that. So first you open up the conversation with an introduction, then a bit of factual information, and then a case review, what was best for you, what was worst for you, and then you go into your grief response. This is a very critical stage where you will get a lot of emotions out. Like, what have you experienced since the death? Because we are all human beings. We can say that when we walk out of the doors, we leave the work, but it doesn't really work like that. We have to look at the holistic picture. It is very, very common for people to carry what they do at work and carry what they do at home to work as well. So it's good to ask the candidate, what have you experienced since the death? So it can be examples like, they can be physically drained out, they could be emotionally drained out, there could have been some behavior changes, cognitive changes. I can't really clearly think like how I used to, I still keep thinking about that patient. Or a spiritual response. I've started to do a bit of meditation now. I've started to practice yoga now. So find out how they are coping with this stress. And finally would be your emotional stage of the framework. What will you remember most about this patient or the family? Oh, I still remember that beautiful flower that she gave me or the box of chocolates she gave me. Could be something simple as that. Any questions until here with the stages, or do you have to go through anything? It's the same thing as given in your handouts as well. Okay. So, okay, cool. So we'll just scaffold it slowly by one. So we'll go through one topic. We have gone through the debriefing framework. Now we will build up on it by giving you a live sample debriefing. What I'm going to do now is I'm going to give you a scenario. And I am going to pretend that I am the candidate. You both are my debriefers. So you can take turns in asking questions and we can go through this quickly in 5 minutes time so that we can just find out how it feels. So I'm just going to sit down here. Okay. And the case scenario is I have looked after a 72-year-old male who came to hospital with complaints of abdominal pain. He has history of ischemic heart disease, cardiac bypass, and he is on anticoagulants, blood thinners and all those things. On day 2 in the hospital, the patient was self-carrying and ambulant. He had no risk of fall, but the patient went to the shower, slipped over a wet linen left on the floor in the bathroom, hit his head on the rails, developed a subdural hematoma and passed away in the hospital on the same day. And this is my patient, example, I'm just providing an example. And this is my patient and I have looked after this patient during my shift and this has happened during my shift. Now I am completely stressed out now and I need a debriefing because I am feeling so guilty about it that I could not do anything to stop this mishap from happening. So there you go, that has happened. He has had a fall, had a subdural hematoma and has passed away on the same day. I was the nurse looking after this patient. I'm very upset. So you can go through that and we can take turns to just ask you a few questions.
So we'll start from the introduction
Yes,
phase.
yeah. So each one can do on one phase. Yeah.
So, hi, Pradeepa, right?
Yeah, hi, my name is Pradeepa.
My name is Richa, so I'm one of the CNE working in the hospital. We just came in to debrief with you for what has happened in the ward.
Yes.
And we want you to be comfortable speaking out.
Yes.
Because whatever we're going to speak will remain in this room, and then it's not going to go out of the room, so we'll maintain the confidentiality in here.
Yeah.
So if there is any questions that you want to ask or anything, you can do ask us.
Yes.
And I've got Ellen here with me as well.
Hi, Ellen.
Hi Pradeepa, how are you?
I'm
How are you
good,
feeling now?
I feel a little bit better that I've got someone to talk with.
Okay, so I mean, this is just an open forum for all of us,
Yes.
just pour it out. Whatever is in this room, you discuss will be staying in this room,
Yes.
okay? There is no right or wrong answer. Whatever is there, you have to chase it out.
Yes,
okay?
sure.
And we're here to help you
Thank
in
you.
other way that we can help, but just, I mean, tell the truth. I know you're feeling something inside, which is you feel like uncomfortable because you were not there when
Yes.
when this happened.
Yes.
Okay.
Exactly.
So just bad luck. It
Yes.
just happened like that. But bear in mind,
Yeah.
you're not the only one who are really involved into this one. Everybody
Yeah.
is really having problems at the moment. But
Yes.
thank you for inviting us to talk to you.
Thank you so much for helping me out as well.
So we'll just go through a few things
Yes.
before we start. So what thought comes to your mind when you think about the incident, or how were you involved in looking after the patient?
I just started my shift and this patient was walking, talking very well, and then it was a shock for me. It was a big shock. I felt really shocked at one stage when a person who was walking and talking very well and quite self-caring and ambulant suddenly tripped over a wet towel and hit his head against the rails. I felt like so guilty that why didn't I just go and check that bathroom to see if there is any wet linen on the floor. I have been prioritizing other things in the ward and for the best of my patient, whether they have their medication, everything. This is very simple, which I know that I am not completely responsible for it, but at the same time, I feel responsible. I feel like I've got the duty of care. So I did feel really guilty about it. So yeah, that's what I feel.
So you have to learn how to detach your emotions to the patient, you
Yes.
know, or else you can't function the whole day of your 8 hours.
Yes.
Okay. So I know it's very hard because you've been looking after this patient and you know him already since the first admission, and you want to give everything, your TLC, everything to this patient. But I know it's very hard. Okay.
Yeah,
So.
yes.
I can't really pour it out, but thank you for
Yeah.
testing it out.
Yes.
You feel better after.
That's right. Exactly.
So, okay.
Yeah, so do you roughly remember the time of when the incident happened?
It was around 4 o'clock in the evening. Because I remember just going and checking on the patient 10 minutes before that, just because he called the buzzer and I was doing my documentation as well. So I remember the time on the computer. I'm just gonna quickly, sorry, I'll just have a drink of water and come. Sorry about that.
Sure.
Thank you.
Thank you. Then it was around 4-ish.
Oh, okay. So, so what was it like to look after the patient, and what was the most distressing aspect of this case? I know you've gone through feeling shocked and guilty, but any other emotions that you're feeling?
He was he was a beautiful human being. I've looked after this gentleman for the past 3-4 days, and so I've developed a rapport with him and was trying my best. He was very respectful to all the nurses and no issues with very compliant patient. He was very thankful to all the things that we were doing. So that actually made him even more special amongst us. And to the most distressing part is for him to, from a really good stage, to deteriorate so quickly and even die within that 8 hours of time is the most distressing part. I can't believe that such a thing can happen. I'm still in a shock.
Okay. Okay. What reaction have you experienced after the death?
Sorry,
What reaction have you experienced since his death in the first
reaction
1 or
in
2
sense
days
like
now?
Emotions?
Yeah.
Well,
Any differences that you found on
Different.
yourself, something that is disturbing you even after you leaving work?
oh
or-
yes,
Yeah.
yes. I still feel emotionally drained. It was a lot on the first day. Slowly it is getting a little bit better, but I still can't get it out of my head. I think I've told myself that time would be the answer. Maybe after a month's time, I hope I will forget everything and I will move on, but I'm trying my best as well. I think this debriefing session is very good. It's helping me a lot because I'm able to vent out what was inside my heart and mind, and I started to do a little bit of meditation as well, just to keep my mind peaceful. And because I have to come back to work, and my manager gave me a bit of de-stressing leave, but now I'm back to work. I have to start concentrating on my other patients, so I'm trying and doing my best.
Yeah. Do you think it's helping, or is it affecting other areas of your life as well, like personally, at home, or at work? Or do you think that days off and then meditation is helping you?
Initially, it was affecting my family,
Yeah.
because when my daughter was saying something, I was not paying attention. She has got an award, and then this big thing for her, my mind was still here, and I was like, oh, is it okay? All right. So I was not 100% at home, but that's slowly going away, fading away. So I think it is helping me. But is there any other resource that I can use in case I'm not able to move over it? Would I be referred to somebody else?
Have you spoken to your husband? I mean, you sat
Oh,
down
yes.
with him, and
Yes.
does he know what's going on about you? Of course, it will affect the whole family.
Yes.
So
But he's very supportive.
Very supportive.
He listens to me, so I think that has helped as well. So it's going in a good way.
So have you got support, or have you asked for employee assistance program?
Yes, my manager mentioned about it.
Yes,
I've
yeah.
called them, so I fixed the first appointment, which is going to,
Yes.
tomorrow.
And you know the telephone number that
Yes.
you can contact them.
Yes. And then I will ring them. I've rang them. I will go and meet them tomorrow. I thought my first appointment,
Yes.
so I just go.
So it will be like a debriefing session, and then whatever you talk to them will remain confidential
Yes,
as well.
yes.
So it will be a good time to take whatever is inside you or whatever is bothering you out.
Yeah.
Yeah.
Thank you.
I hope they will give you a very, very good support on that one because that's their expertise,
Yes.
okay?
Mm.
So you have done your appointment with them?
Yes, I have. I have.
Well done, yeah.
Yeah.
Don't put it too much, just earliest as possible if they can, and then you can talk to them.
Okay. Hi Ellen, how are you?
Good, thank you, Ija. Thank you for coming.
Oh, I'm all glad to be here. Now you know that we're going to have a bit of debriefing regarding what has just recently happened to you and on your ward with the patient. So I want you to be open because this is something that whatever we talk here is going to stay in the room. So I don't want you to have, step back and then close your feelings out, but I want you to voice out everything that you're feeling, all your frustrations that you're going through, or things that you can, remember of this incident. And
When we received, when we having a handover, the patient said that he was okay and everything, and then after that we're just having rounds and go back to the patient. And then suddenly we just found that the patient was unresponsive. So I was really shocked, but I didn't pretend that I was shocked. Okay? And I was really deep inside. I said, "What happened? What happened?" And I was just, petrified about that, and a bit distorted, like scattered brain, and I don't know who to call. So somebody called already. And then we've been doing all of this one, but we have to organize, because we are not doing as like as a team working team. Nobody is coming, even though we press that one, and it's not really a very good team in the afternoon. Okay, because they want to focus on their own patient. So I have to raise my voice a little bit, and he said, come. So and I thought we were doing the right thing until the advanced life support nurses came, and then the patient, they were able to come back again, that patient, and I was just become, my adrenaline is rushing, and I was been blushing, but I don't want to show it to them because I was the team leader for that day.
Yeah.
So I said, come on. And then after that, oh my God. Anyway, the patient went transferred to ICU and he was all right. But the problem is we didn't found out that he got a brain injury. And we've been doing everything for this patient, and I didn't know that he did like this. So I said to my mom, I said, I can't work like this now. So the next day I just, went down and I went talk to her. I said, can I talk to you? Because it's still heavy and it's just trauma for me. The patient was all right when we were having our rounds, and then suddenly, patient just had, I don't know if it's a seizure, but it just, making like this. And then there's no teamwork. Even though I raised my voice, no teamwork. And then I think I need somebody to talk to me because I can't get it out from my head, and I can't sleep, and I didn't have appetite to eat at home.
Yeah.
And I'm talking to my children doesn't, they're not interested because I don't know what they're talking about, Mom. It's your business. But I call my friend, but they cannot understand because I can't tell them the scenario. It's confidential.
Oh, okay. I can see that it's distressing you a lot. Now, I really want to go through a few things that you've just told me. Is it that the most distressing aspect of the whole case, the incident that has happened, is that there was no teamwork?
No teamwork. No
And you
teamwork.
struggled a lot calling for help and then getting the resources?
No one is helping until the advanced life support nurses came, until the nurse came, and that's the only one that relieved me. But still, I can't do it. I got only pair of hands to do it. But at the same time, I'm talking like this, but no one is listening because also is a skill mix, okay? I got some agency nurses and AIN who cannot help me. I tried my best to do everything, I'm perfectionist, but I can't tell everyone to be perfect on that kind of situation.
Yes. So now, do you remember like the time or the day or how far or how long ago the incident
It
happened?
only just happened 2 days ago, and then it was the start of the afternoon shift, okay? And we just finished handover, and the morning staff, they're about to go, okay? And it just happened around like 3:30 or 1:45, and of course I don't have enough staff already.
Yes.
So
have you talked to the manager regarding how stressful it was? Have you looked into or thought about getting some days off just to relax a bit? And
yeah, but the
reflect on
next
what has
day
happened?
I tried my best not to come because I was rostered again afternoon shift.
Yes.
So on that day, the next day, I'm just trying to recall and reflect what I have done right or wrong, okay? And I want to apologize if I just raised my voice to the rest of my team, okay? But and then the next day, I went to see my mom, but she was in the meeting, so I was pushed away. But I said to myself, before she goes home, I will get an appointment to see her. I want to talk to her to pour it out all my anger.
Yes, so what I'm going to do now, because I can see how it is still triggering you and it's pretty fresh, the incident that has happened, and you're still at work. So I'm going to liaise with your mom and then see if you can get a few days as a stress leave or just as a leave just to get relaxing and then get emotionally and mentally a bit stress-free. I'll also organize some employee assistance program sessions for you that you can even do it from your home. It will be confidential. You will be able to pour your heart out more to them, and it will remain confidential as well.
Thank you,
easily
Richard.
accessible.
Thank you for that support and thank you for coming. Really, I want to talk to someone about this. But because my nun is not really a big support to me, she will just talk to all of us. We're having a meeting, but of course it will not be discussed. But I have to go to her with a closed room, so she knows what I'm not happy with my team that day.
Yes, and then after we all do all of this, we'll also have a group meeting so that we all can discuss about frustrations or anything that's going on our mind, because you did say you feel a bit bad that you shouted on your colleagues and everything, but that comes because that was a demand of the situation then, and it was pretty reasonable at that time. So we could go through a bit of debriefing all together as well.
Okay. Thank you, Richard,
You
for
feel
coming.
alright to go?
Yeah, I'm
okay.
alright.
Just stay here and then I'll get the num as well. I don't want you to go back to work as long as there's nothing important to do, or I'll organize another nurse to do it, okay?
Yeah. But I'm looking forward for my 2 days off, and I will see how I will go for my first day back after 2 days off, okay? And thank you for coming and listening to me. And I hope I don't want to create some conflict to my colleagues.
Yes, of course.
Okay?
Yes.
And I want it to be come back running smoothly, nothing, no hard feelings to each other.
No hard feelings.
Okay?
Yes.
What is past, it's past, that we have to move on. And then we are here for the patient safety, but because I was not safe for that day. And thank you. Thank you.
So we will give ourselves some time, give yourself some time, give other staff some time, and then we'll have another debrief session all together as well.
Thank you, Richard.
Okay, that was a beautiful debriefing session you both did. Because of the recording issue, it's still in the recording. This was the assessment that they did for this session. You have gone through a lot of things that were shown up here, which I discussed before, like writing a debriefing report with the example. You went through all those formats beautifully, you went through all those phases, and then the vocabulary used in the debriefing report, I wonder, I was scared, I was depressed, all those things you have done beautifully. but these are some of the examples of the words that the candidate might be using. So you can use that handouts that I've given you.
Yeah.
So the phases of debriefing, the vocabularies, then the report writing format. Did it help you?
Yes.
Yes.
Has it improved?
Yes.
Oh, lovely.
Still need, I think I still need to improve on my, you know how emotionally she starts crying.
Yes,
so I
yes,
can't
yes,
concentrate on writing. I
Oh.
just
Exactly,
have to
yeah.
give full
Yeah.
attention.
That's
to
always
her.
like that.
Yeah.
When they done the briefing,
That's right,
some
yeah.
started to cry.
Yeah. So the themes that came out here was working as a team, and then unexpected death. There was a few conflicts with the family. They were afraid to notify the family. So those are the things. I will go through those reports that you have written, and then I'll give you the assessment feedback as well. So you did an amazing job there. And then yes, so we have gone through those. We have used different sensory things there, bit of PowerPoint, bit of handwriting, bit of role play scenarios, sample work. We have chunked it. Did it help you guys? Yeah, lovely. So finally, we are coming to the feedback of this session. So I'll give the feedback form to you guys, but you can fill it later on. That's fine. And then the conclusion. We come to the conclusion. Do you have any questions now? We will meet. Yeah, we will meet up again.
Yeah.
So the summary of the session is we did the debriefing. We have had our oral communication skills practice, and we had report writing skills practice. We have got formats developed and templates developed for you to help with those real situations when you go out. And the assessments, you have done one assessment with me. Oral communication, I'm happy with both of you. You did an amazing job. You did 2 assessments with me actually. And the report writing, I have to go through it, and then I'll let you back, let you know about it through the email. Okay.
Sure.
And then I will get more reports from your manager if you undergo similar situations, sample works that can be used to assess you more. My contact details are in the email that I've sent you. My phone number is there. Did you get my emails? Yes. So my email, my contact details, phone number, everything is there. So it's more of work-based practice as well that you will be going through. So there's some of the references that you have gone through. Any questions you have?
Okay.
We'll meet again. Today is, we'll meet again next week on the 20th of probably next week on the 5th of December, and we will do one more session at 2:30 in the afternoon. Is that okay? With both of you?
Yeah.
Let me know if there is any conflict with the time and the date. I'll send it, invite you through the email.
Okay, sure.
Thank you so much, Richa.
Thank you,
Thank you,
Richa.
Ellen. And